to be interrupted too.
Perfect. Okay, sounds good. Well, I will let you go. I'll
Great.
see you in a sec. Okay. All right. Bye.
Okay, so a little bit about my background. So as I said, I'm a movement disorders physician. That means specially trained in managing Parkinson's disease, and I'm a neurologist. That's kind of usually how you get there, at OHSU and the Parkinson Center of Oregon, and then also at the VA. I actually spent a year of my training at the University of Massachusetts, and the information there that's interesting is that the mindfulness-based stress reduction program that the Brian Grant Foundation is going to be offering was actually developed at the University of Massachusetts, or UMass, it's commonly called, by John Kabat-Zinn, who was a PhD professor there at the time. I'm not sure if he's still there, to be honest, but I was able to take part in the mindfulness class myself while I was there. Absolutely loved it, and really was interested when I started fellowship out here at OHSU in trying to do more research in this area. So that was about 14 years ago now, and when I first, as a fellow, presented the idea of doing research in mindfulness, the response was, "Oh, that's ridiculous. No one's going to fund that, and it's too wishy-washy. People aren't gonna like that." And it would have been great if I had pursued it then, because I would have been way ahead of the curve as mindfulness has become more and more, I think, accepted and looked at and appreciated. So I have done some minor research in the area. At this point, I'm not doing quite as much on the research side, so not pursuing a lot in the research realm, but do speak often on mindfulness to groups. Really think it's a wonderful tool, and really think stress and stress reduction is key. So I was really excited when Katrina contacted me about the Brian Grant Foundation starting this class. Like I said, I took the class myself. Katrina's taken the class herself, and she's kind of drinking the Kool-Aid, so to speak, which I did as well. And I think it's just an amazing resource. I've retaken the class since the original time that I took it, now about 15 years ago. I've done some other kind of related classes where it's not just mindfulness, but an incorporation of a few things. And then, like I said, I've done a little bit of research in the area as well. So just to talk about what I'll talk about, I'll do a little bit about emotional stress in the brain, just kind of in general, and then talking about what emotional stress is, and then emotional stress in Parkinson's disease, both in terms of the development of the disease and then the symptoms, and then stress reduction and what mindfulness specifically is, and then talk about some mindfulness successes, both in some other diseases and then in Parkinson's as well. So this is a busy slide. The point is not for you to look at all the details, and I'll have a few busy slides, unfortunately. It's just kind of the nature of this topic. But I think the big thing to look at here is there's a lot going on with stress. So it's not just one thing. And I really equate stress and stress reduction to exercise, because I think both of them deal with all these different parts of our brain and our body. And we know that Parkinson's doesn't just affect one thing, right? It causes constipation, it causes depression, it causes your movements to change. It's a lot that's going on. And we've had so many pharmacological studies where we've tried to slow the progression of Parkinson's, and it fails. Exercise looks pretty promising. It's hard to prove that for sure, but it looks pretty promising that it's actually slowing the progression of the disease. And I think stress reduction really has that same potential. And I think for both of them, it's because it does affect a lot. That means it's messy and it's harder to do research in, but I think it's also potentially that you're getting, you know, a lot more bang for your buck. So that's kind of what this is to show, is that there's a lot going on with stress in the body, and it's not just doing one thing. And Iris just mentioned about inflammation, and stress increases neuroinflammation. So reducing stress can potentially reduce neuroinflammation. There's oxidative stress, there's decreased neurogenesis, so actually reduction in your ability to create new neurons. increase in neurodegeneration, so increase in the breakdown of things. So all these things that are not good, are related to stress. So what is emotional stress? This is sometimes harder to understand than it seems like it should. And a lot of what the mindfulness class actually starts with is trying to think about stress and what does stress look like. I sometimes think that it's easier to look at what isn't stress as opposed to what is. So, thinking about sitting on the beach, relaxing, beautiful sunset, watching the waves, for I think the vast majority of people, that would be pretty relaxing. So the antithesis, the opposite of emotional stress. This is an older scale that looks at stressful life events. And the reason I like to show this is that sometimes things that are stressful are actually good things. So number 7 is marriage. So the 7th most stressful thing that can happen to you in your life is to get married. We think about that as being a very positive thing, right? But even positive things can bring stress to our life. I actually can share something this morning. We made an offer on a house yesterday. I am just got an email that they think it's probably going to be accepted. That's a good thing, but it's a little hard giving a talk after just hearing that information. And it's kind of, my heart's racing a little bit. I'm a little like, whoa, okay, what's going to happen? Taking on a mortgage, that's where I am right now, I guess, number 20 there. And especially as you get into these lower ones, vacation, major holidays, these are things that do cause stress, and we can have a lot of things kind of build up. So 150 points or less on the scale means you're relatively low amounts of life change and low susceptibility to stress-induced health burnout. 150 to 300, about a 50% chance in the next 2 years, and 300 or greater, there's about an 80% chance that you're going to have some stress-induced breakdown of your health. So again, what is emotional stress? So this is a number of years ago when I was on vacation with my young son. I was actually pregnant in this picture as well. This is kind of the good picture of all the stress, right? This is kind of the reality, more likely. My parents had also moved to town not too much before that. This is now with the baby born. I think my husband's back there doing something in the kitchen. But my score at that point was 290, so pretty high, even though, I had a good job, I had good family support, I had 2 healthy children. So again, good things can lead to a lot of stress, and that's important to know, because I think stress reduction is for everybody, not just for people who we classically think of maybe experiencing depression, anxiety, things like that. So also, what's stressful for one person may not be stressful for another person. I actually had this in the slide in my talk prior to giving this talk for the Brian Grant Foundation, because I've given some related talks before. But for Brian Grant, probably going up for that foul shot was not that stressful, right? If you're going to get super stressed out doing that foul shot, you're not going to make it. And NBA players can make the shot most of the time. So for them, there's things that for some of us, if I was put in that situation, I would be shaking and, just really not be able to perform. But for them, this is a stress that they learn to manage, and maybe even not a stressful situation. For others of us, this is a picture from John's Marketplace. I don't know if anyone's in the Portland area probably has been to John's Marketplace. I live just down the street from Multnomah Village, and go to John's often. They have an unbelievable beer selection. It's insane. But for me, this is actually a little bit of a stressful experience going into John's, because every time I'm like, oh, there's so many choices. What do I get? Do I get bottles? Do I get cans? Do I try something different? Do I go with my old favorite? So many choices. So again, stress can come from things that seem pretty basic, or big things may not be stressful for us, depending on how we approach it. So does emotional stress increase the risk of developing Parkinson's? Hard question to answer, but maybe. And that's most of this talk is going to be maybe, is the amount of research we have. But there was a study done a number of years ago looking at average number of stressful life events in persons with Parkinson's and persons without. And they found, sorry, go back there. They found that in persons who had Parkinson's, they had experienced 7.2 stressful life events, and these were like big things over years, and then 0.93 in persons without Parkinson's, so less than 1. And these were kind of major things: death and disease, children's deaths, spouses' deaths. You can see kind of down there, but big things. And I think, I haven't looked at the study very recently. I think it was like over the 5 years before diagnosis. I believe it was about that ballpark, but it was for a period before the diagnosis. So is this, clearly representative that it does? No, but it's suggestive that there may be a relationship there. Does emotional stress affect Parkinson's symptoms? Well, if you read any movement disorders textbook, it says, and stress makes the symptoms worse. Again, the data is a little variable, but it seems like, and a little limited. Tremor, dyskinesia, and freezing of gait. So tremors, the back and forth regular movement. Dyskinesia is that wiggly kind of fidgety movement. If you ever see Michael J. Fox interviewed, he's got pretty significant dyskinesias. And then freezing of gait. So that when your feet kind of get stuck and you can't get your foot to move. All those things seem pretty affected by stress. This was actually studied done in 1967, and another title I've given in doing this talk was what the 60s got right about health and well-being, because I think in the 60s there was this more of a connection between mind, body, stress, and so forth. So this was a study done by Dr. Marsden, who is considered the father of movement disorders, in 1967. And that picture there is what people's tremor looks like. And the first one, they just gave people saline, so salt water, and you see a little bit blips of tremor, but nothing major. And then they give people an injection of adrenaline, and it got going fairly, briskly. And then they made them do mental arithmetic, and it got going much more briskly. So basically math gives you more natural adrenaline and makes your tremors worse than giving adrenaline itself. So kind of a neat old study there. And then this was a very recent paper that was published, and this was done by a survey. So surveys aren't the strongest evidence that's out there, but they looked at 5,000 patients, so pretty big numbers of patients, and did this big survey. And they asked people, and I think often, you guys know as patients, you're pretty good reporters of your own symptoms, of how their symptoms changed with stress. So the maximum it could worsen was here. This black line in the middle is that there was no change in their symptoms, and then the other side is that it improved. So tremor was the one that stood out the most as getting worse with stress. Sleep problems, depressed mood, slowness or bradykinesia, the gait and the freezing, and then dyskinesias. So that all these things for the majority of people got worse with stress. There was a variation there, and not everyone experienced that same thing. And some people said things improved with stress. So maybe for some people, either what they judged as stress maybe wasn't really stress, or they might just react to things that other people would consider stressors in a different way. So what do we do about stress, right? So this is something we can't really avoid. So we're going to have to figure out how to manage it. So exercise is a good one. This is actually from a Parkinson's walk, and I know Brian Grant Foundation too has many exercise resources, and there's amazing resources for this throughout Parkinson's, and I think it's really a key component. And even within mindfulness, sometimes there's some incorporation of exercise, which I'll talk a little bit more about. And then yoga. Again, this is a slide I had before doing this topic. So this is Brian Grant. I think this was at the World Parkinson's Foundation a number of years ago. World Parkinson's Congress a number of years ago, and Indu Subramani, who's a movement disorder specialist in Los Angeles. And I think they did a yoga session together at the World Parkinson's Congress. And this is, again, something that is often incorporated into mindfulness as well. And then meditation, this goes back to the 60s things, right? This is the Beatles, which I suspect most of you recognize who they are. And I think they're guru there. And they did a lot with meditation. And that's a component of mindfulness as well. So what is mindfulness? I think this picture is one of those, a picture is worth 1,000 words. And here we've got the person and they're out for a walk, right? It's this lovely sunny day, the trees are out, it's just, you know, nice. And here they're thinking about, oh, their car's not working right. They've got all this mail to deal with. This may be their boss upset about something. This may be their daughter needs something going on. Their socks don't match. I don't know if that's what that is meant to be, but just all these thoughts kind of racing through their minds, right? And instead of just enjoying this lovely picture, they're focused on all these other things. And then here is the dog, just taking in the beautiful nature that's there and actually being in the moment, enjoying the moment. So either our mind being full or being mindful. Another one that I really like that Jon Kabat-Zinn had said in one of his books was, when you're in the shower, be in the shower. Don't be at work. Don't be cooking dinner. Don't be, you know, mowing your lawn. Just be in the shower. Enjoy that time. I was actually thinking that to myself this morning, trying to just enjoy that time and think about the warm water on my hair and the nice experience of that, and not thinking about all the other things that were going on. So in terms of an actual definition, we say mindfulness is a means of improving mental health and reducing symptoms of stress. Mindfulness is a moment-to-moment, non-judgmental awareness and a means to reduce stress and improve coping. The programs focus on tools to cope with intense physical and emotional situations, relaxation practices such as meditation and yoga, and discussion of the techniques. So a lot of the aspects of mindfulness through the class that's important, and I'll go through a little bit more specifics on this, is that the discussion in the group of how the techniques have gone, how you feel about those techniques, getting input from others about how their practice is going, techniques or ideas on how to improve things, what things you're struggling with. So there's also a component of community that comes from it. And if anyone is involved in support groups at all, I think you can probably relate to how that might be really helpful. And I think it's really, in my experience, it was really a great component of the class to hear what everyone else was going through and to be able to discuss the things that were good and the things that were tough. This isn't always easy. You know, to focus on these things. So there's a lot out there in mindfulness. This was a Time cover quite a few years back now about the mindful revolution, and it's kind of it's everywhere, right, to a certain degree. But I think it also has become everywhere because we've got this kind of stressed out, multitasking, go society of when you're out for that walk, you can't just focus on the trees because your cell phone's buzzing, or you got a text that you got to respond to, or you know, it's hard to unplug, right, and really separate from things. And then I think it's also kind of interesting to think about this muddied meaning of mindfulness. This was from a New York Times magazine, you know, the one that comes out on Sundays. And that there's a lot of different ways that mindfulness is done out there, and you might read some different things. And as Katrina said at the beginning, the mindfulness-based stress reduction is really the gold standard. Is it the best? Is it the ultimate way to do it? We don't know, you know, because there haven't been great comparison studies, but it's really the one that's been studied the most. There's a pretty clear structure generally to how it goes. And so I think it's kind of an ideal way if you're either having done some practice and interested in diving more in, or if you don't have any exposure to it at all, it's really a great place to start, because it is a really well-studied, well-done, well-organized program. So this is what the program typically looks like. And this was taken from an article looking at veterans with PTSD and the way they did it. So there can be some slight variability, but this is really the main thing. And also because it is being given in a group setting and there's discussions involved, sometimes how these end up flowing individual classes, it will vary a little bit. So there's 8 2-hour sessions over the course of 8 weeks. So they're once a week. And then you are asked to do an hour a day, weekly, an hour a day, every day of the week, aside from the day of your class. Some practices on your own. I would say, having done the class a couple of times, no one ever really does the hour every day. I think most people get in, the 15, 30 minutes. Some people do get in the full hour, or maybe do it a couple days a week and not get it. So it is called practicing, with the idea that we can always keep improving on things. But the first class would be kind of an introduction, might be kind of the focus on that there's more that's right than wrong with you. Generally, there's an exercise done called the raisin exercise, focused on mindful eating, a grounding practice, and a body scan, which is where you kind of focus on different parts of the body and kind of relax them progressively from your feet up to your brain. And then the next one, focusing on stress, how our perceptions and our experience impact our mood and our physiology of our body. And then again, doing the mindfulness scan and working on some mindfulness breathing. Next one, noticing experiences and savoring what's pleasant. And then again, in terms of practices, I won't go through all these, but mindful movement. The next class, kind of getting unstuck, noticing unhelpful patterns. One that might be introduced there is a loving kindness meditation, which is a really lovely one. And then a short thing called a 3-minute breathing space. So kind of just taking a brief 3 minutes aside to focus on breathing. Spaciousness for class 5, they did in this one. Chronic pain for number 6. There's generally a half-day retreat. And that tries to have as much silence as possible, and does a lot of all different kinds of meditation throughout the day. And then interpersonal mindfulness. I did ask Katrina when we talked about things earlier if it would be open for care partners to be involved, and it sounds like they are very open to that. And in the classes I have taken, it's been really neat to see some of the communication that's gone on between caregivers and patients, or persons with Parkinson's and their caregivers. When I did it at UMass, actually, I wasn't involved with anyone with Parkinson's taking it, but I had a woman in the class who was pregnant, wasn't married, and was living with her mother, and they were going to be entering this big change in life of caring for this new baby and living under the same roof. And it was really cool to see their communication and the idea that they were kind of preparing for this ahead. And I've seen it with some married couples, which has been really neat too. And then lastly, forgiveness and moving on. And again, there's various practices that are incorporated throughout. And this is kind of the general structure. Some of the specifics can vary a little bit from group to group. And again, if, for example, the chronic pain session, there's a lot that's there and a lot that's discussed, the group might come back to that and spend some additional time on it. Whereas something else may be kind of a bit of a shorter discussion then. So thinking about some mindfulness successes. This isn't a comprehensive example of things at all. I just pulled out a couple of things. It's, gets a little bit tough these days because there is so much literature out there that I did kind of a quick look. And one of the things that was hard in trying to get an overview is that now there's so much in so many different areas that there's not kind of one good single overview. So I'll actually show kind of an older study as one of the examples, because it's a little bit more of a pervasive review of things. So the first one I wanted to highlight was a study that was done in multiple sclerosis. So multiple sclerosis, or MS, is another a nervous system disease. It's a neuroinflammatory disease, actually. And the thing that makes studying this in multiple sclerosis kind of nice is that in multiple sclerosis, we can look at the brain and see if new lesions have developed. So we can see if the disease is active or not. In Parkinson's, we don't have a great way to do that. So we can follow symptoms, but we don't have any way to really see, is the disease progressing? Is the disease changing? And what they did was they did a mindfulness course, and they had a group that got the course and a group that didn't. And the group that got the course is in the blue, and the group that didn't is in the red. And then they looked at how many people had new lesions during the 24-week treatment period. And this was a little bit of a variation on the classic mindfulness program. So it wasn't the MBSR specifically. But they found that you can see in this, in the group that got the intervention, the blue group, a lot more of them are without new lesions than in the red group. And this is a gadolinium enhancing, and then this is the T2, which is just another way we look at the different lesions. So, but between these both groups, you can see very, prominent differences, and this just means that it was significant. The p-value was low. So this is objective evidence that, mindfulness is helping with changes that are happening in the brain. So pretty exciting stuff. And then this is that older article I was saying that this looked at, it was back from 2015, but I kind of like it because it looks at a few things. But the main things that they showed the most benefits in were depression and anxiety. So pretty consistently, mindfulness programs showed benefits in these. There's one here that is a little bit variable, but these are the areas where we think probably the most benefits from mindfulness are going to come. And these were in a variety of populations. So people with cardiovascular disease, cancer, mental health disorders, so anxiety and depression, PTSD, chronic pain. And then one was in healthy patients. Again, none of these in Parkinson's, but I'll talk about that a little bit more specifically. So in terms of mindfulness in Parkinson's, there's about 10 studies. I, again, have to admit, I didn't do a thorough, review of the literature for this. There was a review done not too long ago, and then I found one additional study beyond that. And they also show some improvements. The improvements tend to be fairly modest. So these aren't hugely, dramatic improvements. The numbers are also pretty small for most of the studies, so that always makes it difficult to interpret. Is this a coincidence that we saw some benefit? Would we see a lot more benefit if we had a lot more people? The largest study had 71 people in the intervention group and 67 in the control group, but most of the studies were more about 15, 20 per groups. And the areas where they saw improvement included motor function, depression, anxiety, and quality of life. So kind of running the gamut, which is, what we would expect with the idea that this is affecting a lot of things within the brain, not just one. And then the depression and anxiety really fit with that, what has been shown in general with mindfulness, that it can particularly help with those types of symptoms. So this is, again, going back to that survey study, and I apologize, this is a bit of a busy slide, but they looked at how often people did mindfulness and the effects on various symptoms. And the reason why this is nice is in looking at evidence, we'd like to see a dose response so that, you take more of a drug, you see more benefit, you take less of a drug, you see less benefit. And the same should be true for other interventions. So this was looking at people who did once a month or less, a few times a month, weekly, several times a week, daily, or several times a day. And we see that with basically everything that they looked at, everything's improving with the more you do it. And these include depressed mood and anxiety, and those are the ones at the top, kind of like we would expect. Tremor and is kind of in the next range, and then sleep problems, gait freezing, they kind of go back and forth a little bit there. And then slowness of movements or bradykinesia, and then dyskinesia. So again, going along with what we've kind of seen from other things, that all these things can potentially improve with mindfulness. I think we have time. I can ask Katrina if it's okay if we do a little bit of a guided meditation to, or guided imagery to give people a little exposure to a moment of mindfulness, maybe. I'm going to move forward if I don't hear it.
Yes, please.
Great. Yeah, go for
it. I need this myself. So
yeah.
So I'm just going to go through a brief guided imagery. This is again not the full component of mindfulness, but one of the potential pieces. And we'll do it that we're pretending we're out on this beautiful beach. So if you're sitting, that's usually kind of the best place to try to focus on meditations. And you just want to have a nice stance. You want to kind of be intentionally sitting. So if you're slouching, try to sit up straight. And then you want to take a couple of deep breaths. So breathe in through your nose and out through your mouth. In through your nose and out through your mouth. Maybe do about 5 of those at your own pace. And then just to start to focus on your body in the chair. So maybe feel your feet on the floor. Maybe it's the toe pads that are touching or your heel that's more touching. And just kind of focus how your feet feel on the floor. And then maybe focus on where you're sitting on your buttocks, how that's seated in the chair, what parts of your bottom are touching the chair. And now maybe on your back, is it touching against the back of the chair? Or do you feel air kind of circulating there? Do you feel a coolness? Do you feel warmth anywhere in the body? And if you haven't already, maybe just let your eyes close. And then we're going to start to imagine that we're on a beach. And we're sitting in a beach chair. And we're going to imagine what's around us. So we can first think of what we hear. Maybe some seagulls in the distance. The lapping of the waves as the water comes in from the ocean. Perhaps the sound of children laughing in the distance. And just think in your mind about, if you were at the beach, the sounds that would be coming to you. And then maybe think about what you would feel if you were on the beach. Perhaps the sun is shining on your forearms and warming them. Shining on your face, and again, warming your cheeks. Perhaps you can feel the cool sand in between your toes. Again, just take a moment to think about the feelings you'd have in your body if you were sitting on the beach. And now maybe think about what you would smell, that salt water smell in the air, maybe coconut sunscreen, the smell of fish sometimes. And again, just take a moment to think of the smells that you might experience on the beach. And then finally, think about what you would see. Think about the vast water in front of you. Perhaps ships out in the distance. Again, the in and out of the waves, back and forth. Perhaps the seashells, again, that are brought in by the waves and taken back out. And then I'll just give you a moment to just continue to imagine what you would about being on the beach and what the experience would be like for you. Now take a couple deep breaths again. Start to move away from the beach. You can kind of wiggle your toes, wiggle your fingers. You can gradually start to open your eyes. It's often nice to just kind of restrict your gaze and look down at the ground. And then just gradually let the room come back into view. So if people want to put in the chat how that felt, it's kind of a nice, I think, time to do that. Also, if it was difficult, if it was pleasant, if it's difficult, that isn't a sign that mindfulness isn't for you. Katrina and I were talking about this recently as well. It may be a sign that it is for you and that you really need it, actually, because it's sometimes quite difficult to let your body get to that more relaxing phase. I remember in this small pilot study I did with mindfulness, and I had a patient in it who had a really marked tremor. And he said, oh my gosh, that's the first time my tremor stopped when we did our first meditation in years. And that's the first time it's really totally gone away when I was sitting still like that. So it was really powerful to hear that. And I hope other people have that experience and can continue to use these techniques to help in managing symptoms. And hopefully, we hope that this is maybe even changing the course of the disease potentially. So in terms of mindfulness resources, I wanted to kind of finish up with that. Obviously, Katrina is going to tell you a lot about the Brian Grant Foundation course, which is so wonderful that they're offering that. And I would really recommend people try to take advantage of it if they're able to. There's also some other resources if for some reason the Brian Grant course doesn't work with your time schedule, or if there's other restrictions. Brown University has a very big Center for Mindfulness. There's actually a gentleman there, Jeffrey Prue, who used to be at OHSU and worked with me on the one study I did, who is there now doing mindfulness research primarily with Native American communities, with indigenous populations. And then UMass Memorial Medical Center, that's the University of Massachusetts, they were kind of at the forefront of things and still have a lot of offerings. And then University of California at San Diego has a great Center for Mindfulness too. What's really great about their website is it has a ton of different audio files that you can download with various meditations, and they're from very short ones to very long ones. They're guided imagery, they're body scans, they're all over the place, all different people who've recorded them. So some voices you'll find, I'm hope mine isn't a bad one, you'll find that really speak to you and really help you relax, and then other voices for some reason just don't work as well. So it's kind of nice because there's a lot of options there. And then there's oftentimes local resources. I know OHSU periodically does do classes. I haven't looked lately what their offerings is, or, excuse me, what their offerings are. And I also had done one through a yoga center here in Portland, actually in the Selwood area as well. So that's often something, no matter where you are, that it's very likely that there's local groups doing it. And especially if something, you know, in person would work better for you, or that just seems like it would be a better fit. That's something to look into. And you can usually just Google mindfulness. And again, the classic is kind of this mindfulness-based stress reduction class. And I think MBSR is the abbreviation. So the Brian Grant Foundation course, which Katrina will talk a little bit more about in just a minute. And that's the end of